You guys did a great job in the left ventricle yesterday. I have seen some that look like somebody took a chainsaw to them when they finished.
Hey, shots fired.
Little golf clap for the left ventricle.
Are you okay?
Okay.
Yeah. I told you I cut my finger.
Oh yeah.
So I clapped my cut finger.
I was like, aren't you gonna pull up your hair? And then I was like, no, Rosie.
Can't really do that.
You need your poker or your probe for this next part.
Do you want me to get a second?
I'm just put my hand on it.
Okay, I get another one.
On the outside, just go down to the ventricles. That's probably the easiest place to do this. Okay, there is a very, it's almost like cellophane.
Which
almost
ventricle?
Like saran wrap.
Oh, on the outside.
Can you pick off, there's a layer, can you pick off some of that outside layer of the heart?
Oh yeah.
I'm sure she's tickling.
Oh, it doesn't like that.
It doesn't like that.
Oh no.
Ooh, there's a hair on mine.
It looks like saran wrap. I don't know how you want to describe
Saran wrap's a lot easier though. I wouldn't call it saran wrap.
Is it right there?
The saran wrap, also known as part of the pericardium. Am I right, ladies?
Yeah.
Okay, now, rewind your brain back to August. We called that in August, we call that the visceral pericardium.
Yes, sir.
Okay, if you're looking at your sheet, good. I've added that in. Visceral pericardium is about, it's the last one in the list for the heart. But it also has another name called Epicardium.
Oh, because it's on top. So.
What was that peeling sound? Oh my god.
The skin is.
Oh, the skin.
Anatomically,
I said the skin.
Above. All right. There's an epicardium. If you're looking at the white sheet, there's an epicardium, a myocardium, and an endocardium. You see those three words there? Epicardium, myocardium, endocardium. Okay, go inside one of the ventricles.
Pericardium.
And see if you can peel off.
Girl, you just stabbed me.
I did. I always end up stabbing or cutting you.
Trying to shank
That
me.
lines either ventricle. Probably the right one is better than the left one.
Chose that
It's
one in the
easier to
first
get into.
place.
See if you can pick off that same saran wrap.
On the
but
inside?
on the inside now.
You can. So what's
Ooh.
See it.
I don't like these. These are meant to stay on.
Should be
It's more normal.
This is some stuff that's going on here. Am I right, ladies?
Heck yeah, ladies. Yeah, you can see that. Yeah, you see all that stuff right there. I won't go too much into
One
detail.
of the ventricles.
I don't want to stab you again.
And pick it off. You got it right there.
Yep.
Is it myocardium? Oh, I got it.
Okay, you good?
Yeah, is it
You
myocardium?
know, just run through our things real quick.
All right, what's in between those two is the meat. Show me the meat, okay?
Show
We
me
got
the
the
money.
meat right here. That's the myo muscle.
Myo is muscle. It's myo muscles,
Okay, so
not
between
your
those two,
muscles.
Looks like medium rare. Yes. And in between
So
those two,
so the epicardium is the stuff on the outside, it's like the very, very outside. Endo is talking like actually inside the heart, and then the myocardium is talking just about the muscle.
Yes, I think that's correct.
Great.
Hey, Doc.
Okay, so
Doc.
3 layers.
Doc, please come here right now.
Okay, so
The outside is the epicardium, the inside is the endocardium, and the middle is the myocardium.
okay. So when you show me the myocardium, when I say show me the myocardium, and you take your
Would it be
stab the
okay?
meat. That's what you're going to do.
Couldn't we just open the side like this
Who
and point at
who
it?
has the most muscle?
Left.
Without a doubt. It has to be the left ventricle has the most myocardium.
Left ventricle and the lower.
The left ventricle is the lower chamber.
Yes.
The upper chamber is the. Oh, right. Okay.
All right. Do your puppy dog ears? Do they have any muscle? Do they have
Yes.
endocardium, myocardium, epicardium?
Yeah.
Look and see.
I'm gonna say yeah.
Is there a muscle layer involved in the upper chambers?
Oh
as
yeah.
well?
Check that boy out right there. That's some muscle.
And there should be.
And I'm
but
sure
it's not-
inside you can get to the.
It's not real thick.
Can you?
Okay, which one's that one?
Yeah.
Yeah. It's a little more difficult, but you can get to it. I'm sure it's the same like that on the inside.
With the
Cool beans.
Okay.
Is this called the same stuff? Is it called?
She's bare.
This is the way you're supposed to hold it, like that. All right. This is the apex, the base,
That's telling you to say right in
the
the
base.
The base.
And you got your pulmonary
Artery.
artery. You got your
Aorta.
aorta.
Doc, is this called?
Superior
Doc,
vena
are these
cava.
called the same like Epicardium,
Vena
Pericardium? Yeah,
Our anterior
Myocardium,
vena cava always gets
Endocardium.
smushed up.
Same
It does.
thing.
And then our pulmonary veins like
It's
up
called the
in
same thing on the
there.
atrium as it
It's
is
weird,
in the-
right?
Right here.
Yeah.
All right, now, all right.
It's to come right out of our little,
Time out.
what are those things, oracles or whatever?
That's the atrium is the inside and the
Yes.
auricle is the outside.
That's what I thought.
What? I was hoping somebody would have this. Some of you had a little bit of this when you first got the heart. Okay, the epicardium. Now you go to, if I say show me epicardium, you're peeling off that outside later.
Right here.
That's the same
Epicardium.
as, okay, this is a paper question. That would be exactly the same as saying visceral pericardium.
Yes.
Right. If you move, I'm gonna use Varun's, if you move from the epicardium and you start moving out, okay, there's a little space called the pericardial cavity, and then there's a sac that's around this. The lining of that sac is the parietal pericardium. So you got visceral parietal, and you got a little space in between, which is the pericardial space or sac, or excuse me, space. Sac space. But some of you up here at the base had just a little bit of that sac that this thing is going to sit in.
No, we definitely cut
But
that
it was
off.
so, most of
Bless
them
you.
had been cut off by the supplier.
Wait, what's the sac called?
Okay. The pericardial
It's the
sac.
pericardial
is that
sac.
on there?
Yeah,
It's
Okay,
between
Pericardial sac
the
is what
visceral
surrounds the heart.
pericardium.
It's like I would
But it's not the
put a garbage bag around you.
Okay, okay.
Now the
Here
inside
is
line of that garbage bag. Okay, help
And
me
it's
out.
called
What's-
the parietal pericardium,
is
correct?
the parietal.
Parietal pericardium's part
Is
of
that is
the
the out
So that's-
parietal pericardium is what forms
So
the
you got
outside
that
of the.
here.
yeah.
So like it would be say this is the epicardium, also known as the visceral pericardium. My hands
Yeah.
would then be the parietal.
That's what I thought. I just wanted to make sure
And
it
then
was
in
outside.
between-
Wait, is
Edit
the
this sheet a little bit.
pericardial sac, is that the parietal?
But
Okay,
the,
we
the
have
pericardial
done-
sac is the in between.
Oh, okay.
You got it?
Yeah, we're
Okay,
just
okay, that's fine.
yeah, we're good now.
Here's what you cannot find on your heart. So I want you to bracket this or check it or circle it or whatever you want to do. I'm coming down the line. Here's what I cannot ask you on your heart. Okay, I cannot ask you about halfway down arch of aorta.
Yeah, because it's cut off. No arch. It would go.
Yeah.
Or ascending aorta.
Yeah.
And we'll just say aorta.
I mean,
Show
it's
me the
kind
aorta,
of.
but not the different two parts of it. Those two indented parts, okay, keep going. Brachiocephalic artery, left subclavian, left common carotid. Okay, bracket those three.
Those aren't connected anymore.
Okay, I cannot ask you that on here.
Would those be
Now, who's
paper?
got the longest aorta here?
Not us.
Not a.
Mine?
Most of you cut it. Okay. If the aorta went up and then did the arch thing, which I don't think, I thought one of you. maybe
Mine,
had
I think
it.
mine
You have
has-
the arch kind of.
Kind of, I think.
I think
'Cause it has
yours are
three
one that
separate
did. Yeah, and you
holes.
start to
Yeah.
have some holes.
Right.
Okay, these are branches off of the arch. If you're, not everybody has that, so I can't ask it on here.
Oh.
So will you
Well,
ask
which
it
one
as a
do you know
paper?
what these are?
Those will be paper. Those will be paper questions.
Out of curiosity, do you know what they are?
It comes off. Like if you're coming up the ascending aorta, you're headed into the arch. Okay, here's the order they come off of. They come off in alphabetical order. These three you just bracketed. B comes off first, C comes off second, and S comes off third, alphabetical order. Off of the arch.
It's the
Or the
bottom
arch
three that we
in the aorta.
bracketed, right? The
So
brachio,
BCS,
Yeah.
not
and
bottom
then
one
to the
yours,
left common carotid,
they'll
right?
be on
Yes.
yours. Okay, that leaves
Wait.
two. That leaves 2 things to find. Are you okay on those 3?
No, I have another.
Not okay.
No.
Okay, so B,
B is first, and then this one.
then C is second,
So that's common
common
for C,
carotid,
and then that one.
and subclavian is third.
Okay.
Taking off some fat.
Got it? Okay.
Taking off some fat. Did you bracket them?
All right, the last
Let's
2,
put stars next to them. But,
Oh, okay, no, that's fine.
oh no, let's put it
the
next to them.
wall that separates the 2 ventricles and the wall that separates the 2 atria. Okay, that's what.
To this
All
wall?
right, can you put, okay, just look at what I'm doing here. Probably, can you put your thumb and your middle finger down in the upper chambers and try to squeeze, try to touch them, and you're going to hit the wall. That's the septum between,
It's the
that's like the
septum.
wall septum. So enter atrial
Do you want me to
septum.
write that down?
Yeah, because I don't know that.
Yeah.
Got it.
Whoa, what is it? Atrial.
Okay, okay, if you're going, the upper 2 chambers, going between the upper 2.
Is it the
Put your thumb in your middle finger or something.
ventricular septum is this one.
You should hit a wall. You can't get your fingers
And
can't
then
touch.
the,
Because that wall's there. Okay, that's the wall between the 2 upper chambers.
atrial
That's the inter,
is
between
the top one.
atrial, septum, wall. Between the atria, there's a wall. So, okay, you got the wall.
When you ask us this,
That's how you're going to do it right there.
Can I
So
feel
when
it
I
here
ask you
then?
to find
Go
this,
for it.
Alright,
you're
so
going to
first you go
do,
between the
I don't know
two
how you want to do it, but
atrias.
you're
Alright,
trying to bang your
let's see.
fingers together and you're touching the wall, okay? Interventricular septum.
That's this.
I
Down
can
in
show
there,
you the
yeah.
wall,
That's what I thought,
so you
yeah.
gotta come into the 2
Start in here,
ventricles and
so
try to bang.
Yeah. It's very, yeah. Let's see, look at
So I think we're doing pretty good as far as our anatomy goes.
You also need the
ventricular.
That's the
use your teeth.
down in there and up top.
That's the thing legends are made of.
That big section in the middle.
Which one's the thickest, guys?
the intra
Can you tell which one has got
ventricular.
more meat to it?
Yes,
The intraventricle.
because they have more meat to them in general.
Without a doubt.
Because they can pump out the blood all the way throughout.
So maybe you show me all of the parts now.
No.
Yes, including the valves.
Including the valve, it is, oh shit, boy oh boy. So we've got our aorta, our pulmonary artery,
That is
our
everything
atrium right here,
in the top
or our auricles on the outside.
half or top 2/3, whatever.
Okay.
Okay,
All
anyways.
right, next
So
5
you've
minutes.
got your superior vena
Can you run
cava,
that list again?
our inferior vena cava is
Okay, pretend it's
see right here,
showtime.
okay.
You've got
It's
that
because it's all
list
flat,
sitting
right?
in front of you.
You can put your finger in it still. You just gotta open up the hole.
Yeah. Ah, there we go. Big boy. And then you got your pulmonary vein right here. And then we're going to go in. You've got obviously our chambers on the inside. You've got your ventricles both here. You've got your, we said our,
Which ventricle was that one that you were just in?
this right here,
That is.
our right ventricle.
All right, show me the tricuspid.
Tricuspid, I'm pretty sure, is on this side, right? Yeah.
Show me the parts.
You've got 1, you've got 2, and you've got 3 down in here.
All right. All right, and then show me your semilunar parts
There's some other parts are
for your pulmonary.
1, 2, and then 3 back in here.
Yeah. All right. All right, show me your bicuspid.
Because it's on the other side. This big thick boy side. Alright, we've got him down in here. And I'm not 100% sure. Is it like 1,
That's 1.
2, and
Yep.
then the third part is like
Nope, there's 2 parts because
just
it's
oh, that's right,
bicuspid.
bicuspid, you're right. So 1 and 2.
And then show me where the semilunar, aortic
I
semilunar.
honestly do not remember where that is.
All right, it's way back. Oh, sorry. Oh, it's okay.
Back in back down
You
in
see
here.
that back
Is it in
there?
here?
Yeah.
Okay, yeah. So
You see the 3 parts?
yeah.
They're pretty clear in this one too.
Yeah. Okay. And then you've got the parts that's like the
Those are the
something canis, the trees canis, the tree roots.
the tree roots, but what are they called?
They are called your something in here.
Trabecular.
Trabeculary.
Trabecular coronae.
I'm going to be saying
Can
tree
you-
roots on the chest.
Can you show me?
The money.
Let's see. Show me a papillary muscle on this side.
All right. On this side.
On this side. Yeah.
That's right, because I remember it. I forgot where it was. It's like
Hey, Doc.
Because it took all the strings connect, correct?
Yeah.
Is it like, was it like up in here, or is it like right here?
She's up in the atrium.
I'm pretty sure what Doc told me
What'd he
is
tell
that it
you?
is this bump.
Yeah, that's what I was saying right,
Right
there.
there.
That's exactly what I was pointing to. Beautiful.
Yeah. This bump.
Yeah, that's the one I was pointing to right there.
Alright,
Cool, great.
Alright, show me the papillary muscle on the other side.
Yes, ma'am. That one was a lot easier. It's right here.
Yes. Alright, what are those strings called?
Our heartstrings, and the fancy name for them, I can't remember the fancy name for them. I wrote it somewhere.
I want to say they're the chordae tendineae.
Yes. I want to say that you're correct. I don't think I wrote it down there, so I'll write that down in a minute.
Alright, so can you explain to me the pericardium and the parietal and visceral?
Okay. So the visceral pericardium is the one right on the top here, on top of the heart, and then the parietals would be on the outside, on top of the sac, correct?
Yes.
Cool.
Alright, and can you explain to me the visceral pericardium versus the epicardium? Are they the same thing or are they different?
Yes, they're the same thing.
Alright, can you explain to me the 3 layers of the heart?
Yes, in terms of the pericardium. So you've got your epicardium or your visceral pericardium. You've got your myocardium, which is this pretty much this thick meat right in here, and then opening it up, you've got your endocardium. I think that's what it's called, and it's right here on the heart. This bad boy stuff right there.
Yeah, perfect.
Beautiful.
Alright, so I think you're doing pretty good. You're pretty good. You're pretty caught up.
For the most part, yes. And then obviously you got your septums, you've got your interventricle and your
Intra-atrial.
Yeah. Yeah, cool. My R's look like these, so I was looking over there and I was like, what does that say? Like, I
I'm
know.
gonna do it for me.
Alright.
You check me as I go.
Yes, ma'am.
It's always good to put it the way he's gonna wanna see it in you. Like that. Okay, but anyway. So, apex, base. Then you got your pulmonary artery, your aorta. You've got your superior vena cava, got your inferior vena cava, you've got your pulmonary vein, which goes all the way through the left atrium. Then you've got your left ventricle, you've got your right ventricle, you've got your right atrium, which is the inside. On the outside, they're called auricles with an A. For some weird reason. Anyway, and then on the inside of the left, you have the bicuspid. Alright, on the inside of the bicuspid, you have, or for the parts, you have this part of the valve. And you've got your trabecular carne, and then your papillary muscle. Right up here. And you've got, let's see, it's your semilunar, aortic semilunar valve, 1, 2, 3 parts. And then you can flip it. This is your right ventricle. The tricuspid, it's got 1, 2, and 3 parts. Back up here, we've got your semilunar, which is 3 parts as well. 1, 2, and 3. And then you've got your papillary muscle attached to your chordae tendineae, which are your heartstrings. Then you have on your outside, you've got your visceral pericardium, and then in between the visceral pericardium and the parietal pericardium. I always start to say peritoneal, but I know that's wrong. Parietal pericardium, and in between you have your pericardial sac, and then your visceral pericardium is also known as your epicardium, which is this part right here. Then you have your myocardium, which is the muscle, and then even deeper to that you have your you have your endocardium, which is the layer on the inside. So I think that just about covers it.
On the top of the heart, we have the ascending or superior and inferior vena cava, right?
Yeah, you have
And one pulmonary vein.
yes,
Okay.
pulmonary vein, and then there's a pulmonary artery.
Right. I was getting these two mixed up.
Pulmonary vein goes in the same side as the aorta.
Right. Okay.
That's one.
But typically, it's weird because the pulmonary vein has oxygenated blood in it. But typically, when we say vein, it's deoxygenated. And the pulmonary artery is deoxygenated.
Yeah,
It's just wild.
Okay, hardest, except for I know for yours. The hardest one, I think, to find is the aortic semilunar.
All right, are we
Yours
gonna
is so flopped open that.
are we gonna need to show you the 3 parts of that one?
No, just show me one of the parts. You're good.
Okay, cool.
Now, there'll be a paper question somewhere that asks you how many parts there are to it.
3.
Thank you.
All right, and then for paper questions, we're also gonna need to know like the main arteries in the thoracic region, right? Or the main, because you said brachiocephalic,
The
common
3
cord.
coming off of the arch
Okay, just that.
in alphabet. Yeah.
But
that's
you don't
all-
need
that's
to
as far
know the
as we're
ones going.
Are we
No,
gonna learn
after
this
that
in a
we're
bit?
not. No.
So wait, all this stuff down here, we're not gonna.
Yeah, that's part
later?
2. That's in part 2. So as soon as you finish this, I'm gonna show you about part 2.
Okay.
We'll get to that.
Sounds good.
These are too hard. These are blood vessels that lay
And on the heart.
like right on the heart, but
Yeah.
they're not seeable enough. All of them are not seeable enough to do it on the heart, so we're gonna do them on this.
Doc,
Alright.
the order of the different
Okay,
arteries
there's
right here.
branches.
The branches. Is it the common carotid? Is it subclavian to the brachiocephalic?
It
or-
goes
My
in
alphabetical
alphabetical
order, I
Okay.
use that B
Okay.
and that C and that
Common
S to go in alphabetical order.
Okay, so you just want alphabetical order.
Yeah, so that's how they come on.
Well, that's
These are coming up.
But you said we're gonna have this list,
It's
right?
the
Coming up
okay.
the ascending aorta,
Yeah.
then go in alphabetical order.
Did you say we're gonna?
She's
Okay.
got a couple that you
Yeah.
can see hers.
Brachiocephalic and common carotid are the two
But
that
you
I'm
can't see
guessing.
the S one is
Right, the
a little
subclavian.
further down.
Okay.
Did you say we're gonna have the list here?
Yeah,
Like
for
off-
this part,
Okay.
How we doing?
gonna miss me by my hand.
Okay, we're good.
We should get a cup.
Before, oh yeah.
It's pretty close to what it sounds like.
You can do it with your hands.
Whichever side of the best.
Alright, you sing, I'll do the clap thing.
Thank you.
You're welcome.
Are you gonna make another ring?
No, these are too small. Maybe they might fit on my pinky.
Pinky rings. It's a new thing. Toe rings.
That's what I should do. If I put on my toe and kept it on there all day, no one would know. It'd be my own little secret.
Unless we watched you put it on
And
there.
then you take off your
Then
shoe
we'd
and it just
know.
be, ugh.
What are the rooty things in the upper chambers? The ridges in the upper chamber.
In the upper
The ridges in
chamber.
the upper are pectinate, the ridges in the lower.
Okay, what are the pectinate? I was about to ask him about that when he was here.
Apparently they are the ridges up here
The ridges in the, or the,
in the atriums,
okay.
pectinate muscles. Did we go over that yesterday?
No.
Pectinate muscle.
You're an expert jeweler, Grace.
I can't wait for Lindsay to perform heart surgery on me.
Ready for it.
You die.
Yeah, that's kind of the goal, Lindsay. You act like that's not what I want.
You said she's an excellent jeweler. I didn't think about that. I thought of like, actually, yeah. I was like jeweler. I was like,
It's not cool to
June school.
Did you see they had to make a new policy on nicotine use?
Yeah. Because of that.
Freaking freshmen.
What was the old policy though?
I don't know. I don't think we
I
had
just know they
one.
sent out a message and it's like, oh gosh, someone got busted.
Not just someone's like a third of like.
It apparently happened enough to where they
All
changed
right,
the
bye.
policy.
Bag.
I can put them in.
Bye, baby girl.
Bagging 'em in
I love you. Kisses.